Hi, I'm Dr. Kometz, and we're going to be starting a series of videos here for specific conditions. The first one we're starting with is the surgery cases. We're going to show some before and afters, what happens with the patients, what are some of the limitations of matter, and how the body adapts in these conditions. The point of this video is to say that even if you've done this before, it's not hopeless. You can get some help. You came in here, you said you had that burnt out, right? That your L5 nerve, you had the nerve root, you had it at the ablation, they call it, right?
Correct. I had the L4, L5 abrasion. I had my nerves burned at the tips. So the regrowth will occur within 12 to 16 months.
When was that? When did that happen? When did you have the burning done?
I had that done in approximately, I'm going to say June.
So the June of this year?
Yes.
Okay. And that happened June, and you've been in here for, I don't know, a couple weeks, like 3 weeks or so, yeah? Why'd you come in here? So this is now September, or August it would have been, whatever. So what happened after the ablation? Anything? Anything good?
It lasted for about a week.
Lasted for about a week. So you can't address a mechanical problem to the nerve just by burning it off. That's the problem. The vertebrae is subluxated, which means the vertebrae is misaligned backwards, and it's pinching off that nerve there. That vertebrae has to be set straight ahead. If you come back here and you just burn off the nerve that's coming out of here, the vertebrae is still subluxated. It's still going to be a lot of inflammation because the disc is damaged, and it's not going to get cleared up till we set that forward. So that's what we're going to do right now. Good. Bend this here. Scoot up just a little bit there. There we go. A little bit more. Good. So right on that L5, right in there, buddy. All right, go ahead, breathe out. Good, I'm gonna roll you in here, Nathan. There you go. Turn to this way. And back here. One more time to the left. And back to the right. Straight ahead. Yeah, settle here. And let your head just fall over this way. Okay, nice and gentle. What have you learned differently about the chiropractic philosophy compared to what medicine does? What have you learned differently about it? So, I mean, it's very new to you. I mean, it's very new. I mean, you actually came in here from a referral from another person who had surgery, a good buddy of yours.
That's correct.
Yeah.
I came here as just down and out. I came here as my last try at this, if you be. Chiropractic to me was always thought of for my sports injuries. I would go when I was hurt.
Yep.
I've never done it habitually like this. I've never done it where I've gone this long, 3 times, starting with 3 times the first week, 2 times, 2 times, 2 times. I've never done this before, and I could significantly see the difference.
So yeah, you're coming up on your x-ray, because we'll take an x-ray here pretty soon. I could visit number 10 here or so. But as far as what would have been your next step if this didn't work out? What were you going to do?
Continue taking about 36 Advil a day. And
36? No, honestly, how many?
Oh, I really did.
All right, okay. 200 milligrams, I guess. 36 out of 2. Oh my gosh, that's outrageous. All right.
I couldn't walk, so.
Okay.
Now
Well, good,
I only speak the best about what you've done for me, and my wife's seen a difference, my kids have seen a difference, and it really has improved my health, my well-being, and I thank you.
Awesome, man. No, we love taking care of you. The one thing I'll say though is when you're dealing with these issues, when that vertebrae is misaligning, there's a lot of damage happening at that disc, and they take forever to heal. Where a bone, you break a bone 90 days later, healed. If you sprain a ligament or stretch a disc, and that's called a herniation, they could take a year to a year and a half to heal. So they take a long time because soft tissue, I mean, it heals with scar tissue. It has very poor blood supply. It's not like a bone, where bone is made of marrow, lots of blood vessels, and it builds with the same bone cells that osteoblasts it was made with. I mean, fibrocartilage, and that heals with scar tissue. So it takes some time to heal up. But the point is that because you're correcting the vertebrae when it's getting back in a more normal position, you're dealing with a mechanical misalignment. That was the problem. So that's why cutting it out or cutting it without correcting it is never going to help. So, man, I'm freaking fantastic. I'm so happy for you because I know you want to get back into doing all your stuff and getting out with the kids. So thanks for doing the video, man.
Yeah, thank you.
Appreciate it, bro.